And so the second example that we use classically comes from Central America. I think we heard yesterday about health as a bridge to peace, which started out in Central America. One part of it, and the people who developed the program of health as a bridge to peace don't really want to consider this to be a major part, were the humanitarian ceasefires. So if we look at El Salvador in the mid-1980s, you ended up having civil war there. You also had that in Nicaragua, in Honduras, and Guatemala later on. But you ended up having people dying as a result of the civil war, but you also had high infant mortality. Infant mortality was somewhere close to 80 per thousand. Not quite as high as Iraq during the era of sanctions, but still relatively high. Whereas neighboring countries at peace had infant mortality closer to about 40 per thousand. Any thoughts about why infants would be dying? Sanitation could be an issue, although if you're breastfeeding, it may not be directly as much. Yeah. Yeah. Well, that's the thing that UNICEF under James Grant felt was a major cause. But there are other things in terms of disrupted structure that can even affect infants. So they aren't targeted directly as a result of the war. So UNICEF said, we've got an interest in children. So they went to Jose Napoleon Duarte and said to him as the president of the country, your children are dying. And he said, well, why are they dying? Well, they aren't being immunized. And why aren't they being immunized? Because you're fighting. And he said, well, couldn't you at least stop fighting for a little while, and then we'll immunize all your kids, and that'll help. And he said, yeah, but the rebels, they'll never agree to this. So PAHO and UNICEF had relations with the government. The Roman Catholic Church was probably a bit more influential with the rebels. So they went to the FMLN rebels and said again, your children are dying. Why are you fighting? We're fighting for our children, that they're dying. And so again, they said, well, you don't fight very much at Christmas time. Could you at least try not to fight? And they said, oh yeah, we can do that. But the other side, they'll never agree. They got both sides to agree in 1985, immunized between 200 and 300,000 children. And the ceasefire had held there, and it held 2 or 3 times a year till peace accords were signed in 1992. Infant mortality during the war that went down from the 80 per thousand, or I should say, actually, the neighboring countries were 25 per thousand, not 40 per thousand. But infant mortality went down almost in half as a result just of immunization. And so it didn't go down to the 25 of the neighboring countries, but it went down quite considerably. So a fair success as a health intervention, but we also believe that the two sides were able to agree on something, that they had a goal in common, a superordinate goal, the welfare of children, and that may have also helped set the stage to peace. So another health intervention that might have led to peace. So as I said, we're going to talk more about positives here. So I think some of you may have heard of this guy too, Albert Schweitzer, another winner of the Nobel Peace Prize, like Henri Dunant, who won the first one. So Schweitzer decided, he got the Nobel for humanitarian work in Gabon at the Lambaréné Hospital, and he decided that the major threats that he saw to the world were nuclear, and even above-ground nuclear testing. And so he decided to use his reputation to support the end to above-ground nuclear testing. And so he had this address to the Nobel Committee in Oslo. And so the broadcast went around the world, didn't go in the US, that none of the major media ended up having that, but the New York Times had an article about this. And so they gave more airtime, actually, or more paper space to the criticism of this by William Libby from the Nuclear Regulatory Commission. And Libby just said, Schweitzer, you're a great humanitarian, but stick to medicine. You don't know anything about radiation. Radiation now is much safer than it was in the 1930s. In the 1950s, we just used it in shoe stores, but it's no more dangerous, really, than moving up or down a hill in terms of the amount of radiation that you get from these tests, or moving from a stone or concrete type house to a wooden house. So just stick to your medicine. We're the experts. We know best. As it turns out, there were actually more than 15,000 deaths in the U.S. as a result of above-ground testing. They've calculated untold incidence of thyroid cancer. So it was really quite a significant amount of radiation, and the experts didn't know. So again, Schweitzer decided to talk about the dangers of nuclear weapons and testing. He said that these dangers were unacceptable morally, had medical effects. This conflicted with the experts from the government or military. He used the credibility of the Nobel to redefine an issue as a medical issue from a political or military issue.